Hi, Rachel. Hi, Ross. You all right?
Good,
Yeah,
thanks.
good.
Great stuff. Thanks for coming on today. I really appreciate it. We've got obviously an audience out there that are just looking at what they're going to do for the future and where they're going to be and what they're going to do in 5 or 10 years' time. They're trying to make choices. They're finishing the courses off and all the preparation, and they're here today just to find out about all our role, operating department practice. So I don't know whether do you want to introduce yourself to them just while we're here, Rachel?
Yeah. So I'm Rachel. I'm a third year operating department practitioner. I live in Darlington with my husband and two children. So obviously I'm a mature student and yeah, obviously here at Teesside University.
Great stuff, Ross.
I'm Roz. I'm a third year ODP student at Teesside University. I live in Middlesbrough with my husband, my two stepkids, my two dogs. I'm a mature student as well. Yeah.
Thank you. Just, I don't know whether you can cast your mind back. I know it's been a while, right back to when you were sort of like a lot of our viewers today. You sort of sat there and looking and thinking, what on earth is an ODP? Well, where on earth did you find out about that? And why on earth choose it, Ros?
I was doing my Access to Health course at Middlesbrough College, and we were doing like an employability session. Someone came in from course information from the college, and she was talking about all these different roles, and ODP got mentioned, and I was like, "Ooh, what's that? I've never heard of that before." Went home, researched the role, and it just stuck out to me. It sounded so interesting. It sounded so different, so specialised, and that's what kind of drew me in.
Excellent, Rachel.
Yeah, so I was also doing an Access to Health course at Darlington College, and I'd originally gone to do midwifery. And one of the girls on the course was coming to do ODP, and she started to tell me about it. And she was really passionate about it and really excited about it. And she got me thinking, oh, this sounds good. I'm going to look into it. So I researched it, I looked into it, I went for a tour around my local hospital to see what the theatre department was like, and that was it. I was sucked right in.
Good for you. Glad. What about the highlights then? Come on, tell me about the highlights of your training so far. Apart from the wonderful lecturers that you have teaching you, what are the highlights of the programme, Ros?
So it's a very rewarding kind of job. You get to have this really good rapport with the patients that you meet. In a way, you're kind of changing their lives. They could come into surgery with a broken hip, they can't walk, and you're kind of with them through that kind of process of getting fixed, basically. So it is really rewarding, and the academic side is also really good. I'm quite an academic person, so I love getting my head in a book. The course is really, really well structured. I think that the teachers obviously are awesome, so that obviously helps. Yeah.
Thank you.
Yeah, so for me, I am a practical learner, so I find the placement side of things to be my strong points. I find it really rewarding. As Ros was saying, you are changing lives. This course enables you to save lives, and that on a personal level is massively rewarding. From an academic point of view, I really enjoy exams compared to the assignment side of things. So the fact that there is a mix for our assessments, I find really beneficial for me, especially.
Good stuff. And just tell me, for all our viewers, can you give us a couple of top tips, your top tips for sort of looking into something like this?
Yeah, shall I?
Ros.
So I would definitely look into kind of how this course, how you can progress from this course. So after when you've got your degree, where you can go, There's a lot of different roles that you can do. Obviously, to progress your skills, you can go and do surgical care practitioner. You can go and be an anaesthetic associate. So there is a lot of things, and I would definitely say go and have a look at that. Look at kind of what kind of salary you'll be working at. If this course is employable, which I know it is an employable course. The crying out for kind of our profession throughout the Northeast. So it is employable. They always say there's jobs for you here if you ever, obviously, if that's where you want to work. But I would definitely say look into all of that before considering to come onto this.
Thanks, Rach.
Yeah, so my top tips would probably be, if you're sat there thinking, this sounds like something I really, really want to do, but I just don't know if I would have the stomach for surgery. Don't let that hold you back. We have plenty people that pass out or think that they're going to be squeamish in things, and it's all just part and parcel of the job. The best thing that you can do is to research the role, look at all the elements that it involves, look at what is entailed working as an ODP, and you'll see that there's lots of different things that you can get into, lots of different ways that you can show your skills and give of yourself. And it's not all just about the time that you maybe passed out, because it happens to us all.
Yeah, there's been some good stories about people passing out, and not everyone likes blood initially, but something you get used to. And practically seeing, I think you've probably seen nearly every part of someone's insides by now, have you?
Yeah.
Inside the abdomen, the chest, or even the brain, or lots of experiences and views that are quite interesting, aren't they?
Yes, definitely.
Very much.
And it's obviously you've started out in practice in the last couple of weeks, yeah?
Yeah.
And you've got a very different focus at the minute, not just getting all the competencies done in terms of the clinical activities. So what are you focusing on at the minute? Because this course does give an edge that not many ODP courses give in terms of the third year's focus. What's your focus at the minute, Ros?
So obviously, because we're a degree student, we are now focusing a lot of leadership and management. So we're having to kind of run lists, run the recovery, and just kind of get that extra bit on top of what you would do as a diploma, and you just have that little bit of an extra edge in your qualification to say that this is kind of what we've done, and I think it's a really good kind of selling point to say that we will have that at the end of this. When we go for jobs, we'll kind of, yes, we've done our leadership and management, give me a manager's role.
I mean, Rachel, that must be quite challenging in terms of being following a mentor's lead for 2 years and then all of a sudden have to step in up the game. I mean, that must bring a few challenges.
It does, but one of the things that I love about this course is that when you do your leadership and management aspects to your module, it's baby steps. You start off with questionnaires where you look at yourself and you do these questionnaires so that you can see what kind of leader you are, what kind of manager you are, what your personal styles and characteristics are, and you start off with those baby steps. So you're looking at yourself, you're doing these questionnaires to the point where by the end of your third year, you're at the point where you're looking to leading and managing. It's not just boom, your third year, you're straight in. It's that progression over the year where you have that little bit of hand holding to start with, and then by the end of it, you're flying.
Marvellous. Guys, I really appreciate you coming in and chatting with us today. I've just had a thought that you'll be qualified and mentoring some of the people that are watching today.
Wow.
So that'll be interesting, won't it? So thank you, guys, and speak to you soon when you're back on campus, all right?
Thank you.
See you later. Bye.
Bye.